Okay, the doctor has ordered medication for Mrs. Johnson. He has ordered lisinopril, which is for high blood pressure, and he has ordered digoxin. And I'm going to crush these medications and prepare them before I go in the room. Now, you got to make sure that patient's blood pressure is not low, and also that's for lisinopril. And also you need to make sure the pulse is not low for the digoxin. So her blood pressure, Mrs. Johnson's blood pressure is 120/60. Now, if it was less than 100 systolic, I would hold her pill, her lisinopril. And her pulse is 66. And if her pulse was less than 60, I would hold the digoxin. So both of the medication, if I have to hold it because of the vital signs, then I would notify the doctor. But in her case, her blood pressure and pulse is normal. Okay, so I take the 2 pills, and because I'm giving it by nasogastric tube, I'm going to crush them. So I put one at a time, and I crush it like this. So you got to make sure that it's crushed well, because what happens is if it's not crushed well, the tube feeding, whether it's NG or peg tube, it's going to get blocked, and nurses will have a hard time. So you got to really make it like powder. So I'm just making sure, okay? So I'm going to put it in here, okay? So that is 1 pill. Now I'm going to crush the other pill. Okay, I just want to clean this container. Okay, so now I'm going to put the other medication in there. You got to crush the medication separate. You can't administer medication together. So if there's 4 medication, you have to administer separately. So I have 2 medication. So I have already put the lisinopril in here. So this is the other pill, digoxin, so I'm going to put it in the other cup. Okay? All right, very good. All right, so I'm ready to go in the patient's room. So this is to show you what I will take in patient's room. I can put the water in the room, or I can do it, outside and take it in a little tray. So what I have here is water. Now the doctor said that I can flush the NG tube using 30 milliliter of water before and after administering medication. And he said that I can mix each medication using 15 milliliter of water. So that comes from the doctor's order. So what I have here set up is my supplies. I have a pair of gloves. It doesn't have to be sterile. I have something to protect the bed. I have a TUMI syringe, and the medication always should be given by bolus, by gravity. It shouldn't be given ever pushing with a plunger, okay? So what I have here is 30 milliliter of water, then the medication, my lisinopril, then I have another 30 milliliter of water, then I have my digoxin mixed with 15 milliliter water, because the doctor said I can mix medication using 15 milliliter water. And this is my last cup, which is 30 milliliter of water. So I gotta make sure I flush the NG tube so it doesn't get blocked. So water, medication, water, medication, water. Okay, this is how we're gonna administer. Okay, so when I go in the room, I need to make sure I check the patient's name, and I can check her armband, or she can let me know. If they don't talk, then I can use the armband. And I also want to check their date of birth. So I'll be going in the room, and I have my supplies with me. Hello, Mrs. Johnson. I'm back with your medications. The doctor has ordered, it's 9 o'clock in the morning, and he has ordered lisinopril for your high blood pressure, and your blood pressure is good, so your medication will keep it normal. And I also have your digoxin. It's helping your heart pump better. So what I'm going to be doing is I'm going to use your nasogastric tube. I'm going to put water first, then I'm going to put your medication, lisinopril, then I'm going to put water, then I'm going to put your digoxin medicine. It's all mixed in with water, and then at the end I'm going to give water feed. So I gotta make sure that patient's head of the bed is at least 30 degrees. So, there's no chance of getting aspiration, because they can have aspiration pneumonia if the bed is flat. So we gotta make sure that head of the bed is at least 30 degrees or above. And before you administer medication, if it's NG or PEG tube, so in this case it's a nasogastric tube, I'm going to make sure I listen for the gurgling sound by putting 50 milliliter of air into the nasogastric tube and listening with a stethoscope gurgling sounds. So if I hear gurgling sound, then that means the nasogastric tube is in place. It's not in the wrong place. It could be in the lungs. Okay, so that's very important, because patient can have aspiration if it's in the lungs. So that is a must. You must do that. And the other way is to pull some gastric content from the NG tube and test it. And if it's 4.1, it's in the stomach. Okay, so now I'm going to administer, and always give by gravity medication. Do not push the plunger. So I will show you how to do that now. Okay, so we want to protect the bed. All right, Mrs. Johnson, I'm going to administer your medication now. So what I'm going to do is water, flush, medication, flush with the water, medication, flush with the water. Okay, so I don't need the plunger. I take that off. All right, I pinch the tube so I don't put any air in the stomach. I put my plunger. I got water first, 30 milliliter, because the doctor's orders have used 30 milliliter. I'm ready for that to pinch it. The water's going in by gravity. You gotta make sure by gravity. Okay, then I pinch it so I don't put any air. I got my lisinopril mixed with 15 milliliter water. Doctor said use 15 milliliter water to mix medication. So here is my lisinopril going. In between the medication, I have to flush it with water. Oops, sorry. Okay, so there's my 30 milliliter of water. Okay. All right, one more medication, Mrs. Johnson, then we'll be done. Okay, then I have 15 milliliter of mix with water, my digoxin. All right, and I pinch the tube so air doesn't get in. And then I have 30 milliliter of water. Okay, I think our tube needs to be taped again. Okay, so there we go. So my last thing should be, after the medication, flush of water so the tube doesn't get blocked. I pinch it, and then I put the plug so the air doesn't go in. And this is how you administer medication through the nasogastric tube.